It is now well established that the mRNA vaccines cause heart inflammation, particularly amongst teen boys. The question is, at what rate? When health officials admitted the COVID vaccines were the cause of the inflammation, they said it was extremely rare, 1 in hundreds of thousands. That number was then modified down to 1 in 50,000, then 1 in 20,000. Now the CDC claims it's about 1 in 12,000. But that's based on cases that are actually reported. In places with better, more robust reporting systems, like in Hong Kong, the reported rate is closer to 1 in 2,500. Now, a new preprint from researchers in Thailand show the rate might be much, much lower. The study looked at 301 teens between the ages of 13 and 18, studied their hearts before vaccination and after vaccination using echocardiograms, electrocardiograms, and other measurements, and found that 3 teens in the group developed myocarditis or pericarditis, and an additional 4 developed subclinical myocarditis. That's 7 out of 301. Joining us now to discuss is Dr. Peter McCullough. He is an internist, cardiologist, and epidemiologist. He's been on the forefront of the pandemic, bringing us a much-needed critique of the response and a healthy dose of skepticism, much of which has turned out to be accurate. Dr. McCullough, welcome to the show. Thanks for being here.
Thanks for having me.
So walk us through this preprint that's coming out of Thailand. This seems to be 7 out of 301. That rate is 1 in 43 developing some sort of myocarditis, pericarditis, or subclinical. That is massive.
You know, one of the first questions I had is, how come Harvard didn't do this study, or the Mayo Clinic, or Duke? In the biological licensing agreement, the BLA that was issued to Pfizer, and then one that was issued to Moderna by the FDA, they said you have to do studies before and after in children because we have to know the baseline. You have to tell us how many people are really developing heart damage. And, it's been more than a year, and no institution in the United States attempted to answer that. We've been relying on spontaneous reporting, which is likely a gross underestimate. So this paper by Mansugian and colleagues from Ho Chi Minh City.
Was this Thailand or
Bangkok.
Vietnam? Yeah, this was Bangkok. Okay. Yeah.
So this paper by Mansugian and colleagues from Bangkok did the right thing, and they used state-of-the-art technology. They used the Roche high-sensitivity troponin T assay, the blood test that we use in the United States. They used GE high-quality ultrasound or echo, electrocardiograms, and in those who had abnormalities, they did cardiac MRI. So they did it every bit as good as we've done in the United States. And we were stunned to find that in this sample where they lost very few to follow-up, as you reported, that 7 had sustained heart damage. I'm a cardiologist, and I know these data very well. 2 actually were hospitalized, and they were hospitalized for about 4 to 5 days for observation. This was not a casual thing. 29% had cardiovascular symptoms without damage, including, their heart racing, palpitations, and chest pain. The FDA asked the companies for data that's cohort. This is called a prospective cohort study. And here it is. We have to wait from Bangkok, Thailand to get the answer, and it's not good.
So explain to us, 4 of them had subclinical myocarditis. What is that in relation to like actual myocarditis or pericarditis? And would a person know they have that?
Well, that's it. Subclinical means they don't know they have it. This is very important. Remember, whether or not they had symptoms, they all had baseline ECGs, cardiac troponin, and echocardiography. And then the MRI was additional if they had abnormalities. This subclinical is very, very important. That means American children who are getting the vaccine, some of them have no symptoms, yet they're sustaining heart damage.
And what would be what does that mean? What are the symptoms or the long-term problems or complications that you would have if you were diagnosed with something like this?
Because the vaccines are brand new, we don't have any assurances on long-term safety. So we have to rely on other types of situations. Myocarditis is very rare. Before COVID-19 vaccination, it could happen. The background rate with parvovirus or Coxsackie virus is about 4 cases per million per year. and that was established in a paper by Arolio and colleagues from Finland. Our initial CDC estimates, again, because they didn't know the cohort, they estimated 62 cases per million. And then a series was published by Scharf and colleagues from Kaiser Permanente, and they had the number up to 500 plus cases per million. And then you gave the other statistics. Now it looks like maybe in 100 children in a typical school, there's going to be children who are damaged. The prognosis here, or the implications, are unknown. But I can tell you as a cardiologist, heart damage causes scarring. And when there's a scar, that's a setup for an abnormal heart rhythm, and that abnormal heart rhythm can lead to a cardiac arrest. Today, a paper was just published by Flavio Catigiani from Brazil, and he demonstrated that the reason why myocarditis is so important in children is that when there's superimposed adrenaline and noradrenaline in exercise, it is the trigger for cardiac arrest. And it may explain why we've seen scores of athletes die on the field or die during training or other events because it's subclinical myocarditis and then superimposed adrenaline surge.
So subclinical myocarditis would be just as risky as actual, or maybe not as, but if somebody's diagnosed with subclinical, because we're hearing this we've been hearing this throughout when we found out that the vaccines were causing myocarditis. Of course, the response from a lot of people would be, well, it's minor. It resolves itself over the next few months. Or if it's subclinical, then it's really, truly minor. How minor is it? I mean, and you're saying it causes scarring. So can it really, truly resolve?
Well, I can tell you a different mechanism for heart damage would be a heart attack in an adult. So if an adult had a heart attack with these types of EKG changes and elevations in troponin, they'd be rushed to the cardiac catheterization laboratory and have angiography and stenting. So I can tell you as a cardiologist, we take this degree of heart damage seriously. There is no heart damage that's mild or inconsequential. And there are papers now by Jenna Schauer showing it doesn't go away. And she has data in children now with serial cardiac MRIs that's not encouraging. As a cardiologist in clinical practice, I have some young people now that have sustained heart damage after vaccination, and when it's now more than a year.
And what's interesting is so many other countries are banning vaccines, certain vaccines for younger people. We've seen throughout Europe, Moderna being banned for groups anywhere ranging, depending on the country, under 30 or under 18, or particularly to boys. Now Denmark has completely said, under the age of 18, you won't be able to get vaccinated anymore. That's it. We're done with you guys, unless you're in a very specific category and the doctor writes you a note saying you must get the vaccine because you are so sick, you're so immunocompromised. Other than that, they're not offering it yet. We're not seeing that. They're still talking about mandating it for college students in the country. How, even with knowing all of this?
It's willful blindness. They are willfully blind to cardiac damage and potentially death in Americans taking the vaccine. Our CDC told us in February that 75% of children had already had COVID. Now, among other populations, those in high school and college, it may be nearly everyone has had COVID-19. In a paper by Chematelli and colleagues, it's been demonstrated that once someone's had any strain of COVID, they have 97% protection against any serious outcome in the future. And that's even in the oldest and sickest adults. So I can tell you as a doctor in children, the COVID-19 vaccines are not medically necessary. They're not clinically indicated. The randomized trials show no clinical benefit. There's never been demonstrated a reduction in spread. Some people think that adults are using the children as human shields to try to protect the adults. That hasn't been demonstrated scientifically. It's really a diabolical thought. And now on top of that, there are two real-world studies by Dora Bawilla and Fleming Dutra in JAMA, demonstrating even when children are vaccinated, it's a complete waste of time. The vaccine efficacy is far less than 50%, and there's no differential in important clinical outcomes. So I think Denmark's got it right. they should withdraw all vaccination for young people.
And just to kind of wrap up this particular segment before we move on to the CDC and their new guidelines. Okay, so if you see a youth teenager that ends up developing myocarditis, what does their future hold? I mean, my worry for these young men, because this is particularly affecting teenage boys, we know that men, when they hit middle age, are at higher risk of heart attacks. So does this put them at an increased possibility of having a heart attack later in life? Do we even know?
The two major risks of having myocarditis and any severity of myocarditis are the development of heart failure later on and actually having a cardiac arrest. And in other forms of a cardiac muscle disease, when more than 15% of the heart is damaged, we actually put in an ICD to prevent sudden cardiac death. So what does it mean for a child? In a paper by Tracy Hogue from UC Davis, well more than 85% of children are hospitalized. So the kids are out of school because they're in the hospital with myocarditis. Our CDC VAERS system has thousands and thousands of American kids who've been hospitalized with myocarditis. Thousands. And after the hospitalization is survived, if there is reduction in heart pumping function, then we need to use heart failure medications to actually try to prevent the development of heart failure. And I've had to do that in my practice. We treat the inflammation with anti-inflammatory medications, non-steroidal agents, sometimes steroids, and then colchicine. And then there's a lot of testing. The children have to go through serial echocardiography and MRI. They can't play in sports. We know that there's been some important athletes. Fabian Schrump from Europe, a wonderful marathoner. She announced she has myocarditis and actually had to stop running, and her career has been put on hold. So athletes' careers have to be put on hold, and then they have to be monitored carefully over time. And we're on pins and needles that, in fact, they may develop heart failure or have a cardiac arrest. I'm concerned that so many high-level athletes who compete at such a high level and have high-dollar contracts, they actually may not mention any heart pain. They may not mention any discomfort and try to play through this. And we have seen now over 1,000 European athletes with cardiac arrest on the field in Europe, typically soccer, rugby, or other sports, where they've strictly mandated the vaccines.
Wow. All right, let's talk about the CDC guidelines. So they announced, I saw this all over, breaking news, the CDC updates their guidelines. And I was thinking they were going to finally drop the vaccine mandates for people coming into the United States. I was thinking, okay, they're going to let Novak Djokovic play in the U.S. Open, right? They're going to open up the borders for unvaccinated Europeans. Unvaccinated Americans could go to Europe. Unvaccinated Europeans cannot come to America. But no, that's not what the guideline was. They instead, they announced, and on their website, they have CDC streamlines COVID-19 guidance to help the public better protect themselves and understand their risk. So tell us, what did they change today?
The CDC actually did what I consider kind of a cleanup of some legacy recommendations that they had in the past that basically no one was following. They had some recommendations that if you were exposed to somebody with COVID at work, you were supposed to go home and quarantine yourself. Mm-hmm. Well, I can tell you, people haven't done that for months, if not over a year. People get sick at work, they go home. The other workers stay there. People weren't quarantining based on contact, but the CDC got that out of there. The CDC did something else that we had already started to do in clinical practice, is that they standardized the quarantine period for 5 days. Now, they originally had it for 5 days for test positive but no symptoms. We were applying it for those who were sick. And the CDC, I think, very practically says, listen, a 5-day period is reasonable. And if there's no fever after that, you can just simply come back to work and don't worry about it. I think the most important thing that the CDC said was actually something that is going to hopefully stop some activities. The CDC finally came out. Previously, they had been neutral or mentioned a few applications, but here they came out and they said, stop asymptomatic testing. This is important. Stop it. There are still people at work who are tortured by getting a nasal test once a week, even if they don't have symptoms. There still are people trying to take plane trips to Hawaii or elsewhere where some airlines make them take a test. It's got to stop. Asymptomatic testing was never cleared by the US FDA. The WHO said stop doing it in June 25th of 2021. Now, more than a year later, finally, the CDC comes around and says, stop asymptomatic testing. Multiple papers have been published. Asymptomatic testing has a yield of less than 1%. And when the test is positive, it's most likely to be false positive. So all these people traveling who have had to take tests, all they have done is basically screwed up their travel itinerary and put their trips at risk and wasted a lot of people's time and money. I think CDC ought to issue an apology for allowing that to go on for so long.
I doubt that's going to happen. But it does sound like from these new updated guidelines, and I just find it kind of funny that they say, to better protect themselves and understand their risks, when really what they were doing, they were just saying, okay, we reverse everything. We're not, don't test anymore. You don't need a quarantine unless you're the one who actually has COVID. And if you got COVID, you only stay home for 5 days. Right. That sounds more to me like we're learning to live with it, which is something they should have done probably early on. Say, we've got to figure out a way to live with this virus in a way that protects the most vulnerable and allows the rest of the population to go about their lives. And it sounds like they're finally coming around with that recommendation.
I would agree with that, but to be fair to the CDC, the virus has mutated. It's become a far more mild syndrome. Most people have already been through it, so second infections are very mild. It's a much shorter syndrome clinically. I've managed patients all the way through the illness, and I've had patients in the Delta wave, for instance, actually be sick for more than a month, truly be sick. Now with the Omicron variant, I've had people actually completely get better in under 3 days. So it's a totally different syndrome. We've learned how to treat it so they get better in under 3 days with combination early therapy. And I think most important, we've gone from a mindset of COVID zero, getting to 0 cases, just as you've said, to what I call COVID inevitable. It's inevitable. We're all going to get it. It's just like the Spanish flu. It's going to sweep through the country, and let's hope we're on the back end of this.
Absolutely. Well, Dr. Peter McCullough, thank you so much for joining the show. And you've got a book out, Courage to Face COVID-19. Tell us what that's about.
I teamed up with true crime and best-selling author John Leake, and we worked a year on this. And Courage to Face COVID-19, Preventing Hospitalization and Death While Battling the Biopharmaceutical Complex, is a page-turner. It's a narrative, and it's a true crime story. It's not a medical book. It's about true crime. And I think the reader, any reader who's been touched by this pandemic in any way, is going to really enjoy the book. It helps understand a complex reality in the form of a narrative of a story. It's very difficult to keep trying to interpret new sets of data, new sets of guidelines. This is a story, and people are going to love the entertainment part of this, where it relates to history. It relates to current, public figures that you see now, including myself. And, how did I get on Joe Rogan and set the records and beat all other Joe Rogan interviewees? Why did the White House reach out to me? Why did President Trump respond so favorably to the most published microbiologist in the world, Didier Rialt in France, with his original observations? And how did this all come to be, where doctors were trying to help patients and a complex, a syndicate, was actually working to suppress treatment and promote fear, suffering, hospitalization, and death? It's a crime. It's probably the crime of all time, and it's in the book.
All right, Courage to Face COVID-19. You can get that at couragetofacecovid.com, and I'm sure other retailers as well if you just search for it. So, Dr. Peter McCullough, thank you so much.
Thank you.